question.
Thank you very much, Mr. Chairman. And let me just state publicly, I want to thank you and our ranking member for all you've done over the last few years in this area, in your respective positions now, but just even before that, when you're simply members of the committee. It's made a big difference in a lot of lives. And I want to congratulate the administration, too, in this regard. This has been a great area of bipartisan cooperation, and where I think the resources that have been placed there have broadly, made things better, have saved lives. So there's a lot to be proud of here, but as you pointed out in your opening remarks, there's always things to be concerned about. I'm going to have to leave literally after my question and your answer, Director Burwell, because I'm going to chair a hearing with Secretary Burwell at 10 o'clock. So I got to go do that, and I'm sure we will discuss this issue in that hearing. So I do want to give you an opportunity to talk at length on this Great Plains CMS issue. I'm very concerned and troubled when we have 3 different facilities. It suggests something systemic is a problem. And so, one, I'd like to know specifically what are the findings and what has been done to correct them for those 3 facilities. And then, what you're doing system-wide to make sure this isn't 3 needles in a haystack that suggests there's more needles. Last point, if you would touch on it, have you seen any difference between the facility? Would we find the same thing in tribally operated facilities as we're finding in these? Is there any disparity in ratio? And again, if so, why? Or do you think these issues that we found in these 3 facilities we'd find if tribal facilities were looked at? Is this random? Again, I want your thoughts on that, because I do have and I will say up front, I tend to have a bias in favor of tribes basically, joint venturing and operating their own facilities. Nobody holds you accountable. It's very like your own people do. And I know in our tribe, when we took over the operation of our facilities, or began to in the 1970s, made an enormous difference. Almost immediately, we saw wait times come down very dramatically, because if somebody was sitting there waiting too long, they would simply call a tribal legislative official, and you could get your fingers around their neck pretty fast. So it was just responsive. And plus, on top of that, we developed people in our own tribe, gave them opportunities to acquire professional skills, manage big budgets, to do things, and frankly, they've moved on into other directions now. It gave us a cadre of really trained and talented people. So it's an area that I just want to get your thoughts on that, on the contrast between, again, IHS facilities and tribally operated facilities.
Thank you for that question, Congressman Cole. There are very important distinctions, and one of those is on the federal side, we're governed by rules, regulations, pay systems, and tribes have the ability to be flexible. They're not bound by the pay schedules, so they can be very competitive in doing so, as well as the regulations that govern how facilities, but they're also governed by certainly the same rules we are when it comes to certification by the Centers for Medicaid and Medicare Services. We have not had any citations for tribal facilities, and clearly, I think a lot of that has to do with when the tribes operate, they take pride in managing it very literally. I mean, of course, as you mentioned, when there's a complaint by a tribal member, they know where to go. I mean, they're running it, they go to their council. And when we're running it, as we do with 27 hospitals and some 200 plus health centers across the country, they're staffed, and we run according to federal regulations and federal requirements. And the biggest challenge that and this segues into the challenges I'm seeing in the Great Plains area. We're addressing currently the current findings by CMS in those 3 facilities. And they center around having trained, qualified providers. And we are we are trying to carry out the mission with a combination of contractors, a heavy contract load. So if we can't hire and permanent staff, and I think it was mentioned earlier that the biggest solution is to have permanent staff there. But it's a challenge. Many of these locations are very remote, very isolated, and not only is it a housing issue, which we're struggling with, and we put forward the notion, and let's face it, I've talked to many of the tribal leaders, and they have a housing program. They don't have enough housing just for their own members. Yeah. There are 20 people in a house. As I talked to one tribal leader, he says, I can't give you a house to provide for staff. I need those homes for my own members. I'll certainly work with you on space and so forth if you can build them. Ergo, our requests for additional housing. Housing is a real challenge, and we found that out when we were beginning to address the issue with Pine Ridge suicides. We could get healthcare workers up there, but they had to drive 60 to 70 miles. Yeah. And they weren't going to stay there. And so we immediately began putting in place some temporary facilities on the short run, and then some modular. So those are the challenges in the Great Plains area, which are probably not shared other places in the system.
Yeah, and let me just make this point, and then I'll yield back my time that the chairman's been so generous with. I think that's true. I've been to the Rosebud. I think Ms. McCollum and I were on the same trip there and seen the facilities and seen the challenges in terms of the housing. And I want to commend you for doing it. I also want to, while I'm very concerned about this, I want you to know I see a lot of these things as functions of a system that's been historically underfunded. I don't blame this on the Indian Health Service or what have you. I have some idea of the scope of what you've had to deal with literally for generations. And it's only in the last few years, honestly, that we've begun to give you the resources to make the difference that you are making. But I would commend you to keep really look at this, because as the chairman suggests, this is the sort of thing that does make it difficult for us to convince our colleagues to continue to fund the service, which I think is indispensable. And while I have a bias towards tribes operating their own, that's a tribal choice. I mean, I respect tribes that choose to do it in a different manner, and they're best situated to make decisions for themselves as to which would work better for them. It shouldn't be imposed on them from up here. So just thank you for your good work, and look forward to working with you. Look forward to working with my friend, the chairman, the ranking member, and the other members of this committee to see if we can continue to build on the progress of the last few years. So, thank you, Mr. Chairman.
Thank you.